I'm assuming that the primary mode of treatment is still dialectic behavioral therapy, right?
There are some additional ones. So we've also got mentalization-based therapy, schema-focused therapy, transference-focused therapy. Then there's some purely skills-based ones like STEPS, which I am forgetting exactly what it stands for, but it's skills training, something something. I so apologize.
Oh no, you're fine. I know
um,
you know more than I'll ever. I mean, you'll forget more than I've ever known about this
yeah.
condition. So
Yeah, so there's lots of other treatments available now. How readily available they actually are in somebody's community may may make them inaccessible in a practical way, but we do know that they're out there and that they exist. Um, DBT is still really the initial go-to, and what we know about DBT is that they have this wraparound program, so you can get skills training, individual therapy, 24-hour a day skills coaching, and then also having your therapist be in their own consultation group to make sure that they're getting accountability as well. That's still the ideal gold standard, and whenever we can, we want to provide that. But
mm,
that's also, from a systemic point of view, incredibly difficult to provide. The group takes a 6 months to a year commitment many times. People can't always make that commitment for really practical reasons, right? Not their personal motivation, but just, I don't know if I could sign up to be somewhere twice a week for the next year.
mhm,
So I don't know how that I could expect that of the average person who's coming in for treatment either.
mhm.
So we do know there is a lot of research that just the skills of DBT are also incredibly effective. It may not be as great as the full wraparound program, but skills training is still incredibly powerful and can make big changes for people. So, however, we can get them the skills, whether it's a group, whether it's individual, we want to try to get the skills to people as fast as possible after they're initially spotted for diagnosis because it can make a big change really fast.
Thank you so much for mentioning that because I actually led a DBT program or assisted for a couple of years doing the groups, individual, and the whole bit. And it is very intensive in terms of the draw on staff, right? And time. And it's not an easy thing, I think, in terms of treatment to find, especially at certain levels like Medi-Cal and otherwise, because it is so staff intensive. Right,
Mhm.
but I'm happy to hear that it's still efficacious, it sounds like, to have maybe parceled out aspects of the treatment, like the skills training. Yeah, good, good.
It was a big relief too. And in my own private practice, so I don't run a full comprehensive program. And the clients that end up coming to me are the people who they actually wouldn't be willing or able to go to a group at this point in their recovery anyway. Whether that's because they don't have the time, whether it's because they don't have the finances, whether they don't have the transportation, whether it's they just aren't comfortable enough talking about what they're going through to share it in front of other people. And so that actually would have been a barrier to them if that was mandated. So I do like being able to provide it to a different subset of the population that might not be able to access it otherwise.